Welcome everybody to this webinar called Fighting to Breathe. Together we can make air pollution breathable again. This morning we have an amazing list of panelists, and before I get into all that, just wanted to welcome everybody. I see we now have about a number of attendees, and excited that when I saw the registration list, it was really interesting because I think the most exotic a participant actually came from Ethiopia. So whoever that gentleman is, thank you so much for joining. I know it's in a very odd time for you in terms of time zone to be joining us. So welcome everybody. If you can just maybe, put in your chat box if you have a strong preference in terms of having this session in Thai. And what I'll do is I'll quickly switch to Thai right now for those who are coming in and are Thai participants. สวัสดีค่ะทุกๆคนที่เข้าเว็บนาตอนนี้นะคะคือวันนี้แขกรับเชิญของพวกเราเป็นชาวต่างชาติดังนั้นเว็บนาอันนี้จะเป็นภาษาอังกฤษนะคะแต่ทั้งนี้ทั้งนั้นเพราะว่ามีคนไทยเข้ามาฟังค่อนข้างเยอะดังนั้นเนี่ยทางเราก็จะมีการแปลเป็นไทยแต่จะการเป็นแปลเป็นไทยแบบสรุปนะคะดังนั้นสิ่งที่จะเกิดขึ้นก็คือว่าทางเราเนี่ยเขาเรียกมีแชทบ็อกซ์เนาะข้างล่างตรงเว็บนานะคะมีจิตอาสากำลังช่วยสรุปสิ่งที่พูดกันนะคะในแชทบ็อกซ์นะคะดังนั้นเนี่ยขอให้ทุกคนอย่าใช้แชทบ็อกซ์นี้นะคะแต่ถ้ามีคำถามขอให้ไปใส่ใน Q&A box แทนนะคะแล้วอ่านตามนี้ไปนะคะแล้วเดี๋ยวจะพูดเป็นภาษาอังกฤษ so quick housekeeping matters we're going to have a summary translation in Thai, and that summary translation will actually be placed in the chat box. So I'd like to request for everybody to please avoid putting messages in the chat box so that our translator can help do the translation in Thai. But any questions you have, please feel free and use the Q&A box that's in there to pose your questions to the speakers. And the other thing I also wanted everybody to know is that this session is really, the objective of the session is really to be a media outreach for the AQLI Thailand fact sheet, country fact sheet, which the AQLI team from the University of Chicago is producing and it will be releasing very soon. And so that's one of the critical reasons for this webinar. Apart from that too, we wanted to take advantage of also gaining knowledge from public health participants to share with us about what's been happening on the ground here in Thailand, where air pollution is actually getting to levels that are quite dangerous at this point in time. And we wanted to also hear from our speakers who are from Indonesia, who are joining us and telling us more about what they did in terms of pushing for clean air from both the judiciary process as well as the public campaigning process. So without much ado, let me quickly just give you a quick blurb introduction into the Thailand Clean Air Network. So we are a volunteer-driven group of citizens who have pretty much got together about 3 years ago because we see the need for solving air pollution here in Thailand because it's becoming quite a problem. And to this end, what we've done is we looked at this as a structural problem. We see it as being a huge structural issue. And therefore, to resolve this problem, what we've actually done is we've galvanized a whole team of people from different multidisciplines to pull together and develop the first bona fide citizen-driven Clean Air Act for Thailand. And there is an avenue according to the Thai constitution that allows ordinary citizens to do that. If you have a minimum of 10,000 Thai signatories, you are able to submit legislation to Parliament for consideration. And we have submitted that on the 21st of January. So that's now in process. But it's just the start of a very arduous step going forward because there's lots of uncertainty. And right now the situation is on rocky shores because it seems more likely that this draft legislation and along with others will likely be rejected on the grounds that the stance right now is that a Clean Air Act is not necessary. And that just changing the current environmental law in Thailand will suffice. And there are obviously differing views on this. So that's why this webinar is quite critical, because to hear about what is the real impact on this, because we don't see this as a us and them issue at all. We really see air pollution as an issue that should transcend above politics and above any type of division, because ultimately it is about our right to breathe, and ultimately it is about the right to life. So that's a little quick blurb about the Thailand Clean Air Network. And without much further to do, I would like to open the floor on to Dr. Kenneth Lee, who is the director of the Air Quality Life Index from the University of Chicago. And a quick rundown is that Dr. Kenneth Lee is, he's also the Senior Associate Fellow at the Department of Economics at the University of Chicago. Prior to this, Dr. Ken has served as the Executive Director of EPIC, which is the Energy Policy Institute in India, and he was also the Research Fellow at the Center of Effective Global Action and the Energy Institute at Haas. He studies questions in the area of economic development, environmental energy economics, and has designed field experiments in Kenya and in India. So he has an impressive academic background. Obviously, he holds a PhD from the University of California, Berkeley, and an MIA from the School of International and Public Affairs at Columbia University. So I throw the floor to Dr. Ken. Thank you.
Weena, thank you so much for that kind introduction. I will just share my screen now. Okay, so go here. Okay, can everyone see this?
Yes.
Yes, okay, great. Thanks again for the introduction. It's really an honor to participate in this webinar with all of the panelists and to talk about this problem in Thailand. We're really excited to be here, so thank you for inviting us. As Weena mentioned, I am an applied economist by training. I'm a development and environmental economist. And for the past few years, I've been very focused on this problem of air pollution, first in India and then in other countries around the world. Today, I'll be talking about some of the findings from an early release of our 2022 Thailand fact sheet with the AQLI. And this is a pretty short presentation, but I'll divide it into a few parts. First, I'll describe to you what the AQLI actually is and how it's constructed, what it's meant to answer. And then I'll talk about some of the findings for Thailand, followed by the benefits of clean air policies in terms of lives saved. So first, to introduce the Air Quality Life Index, the AQLI. So for decades, scientists have been showing that exposure to high levels of particulate pollution, so that's PM 2.5, these are small particles of dust that are suspended in the air that enter your lungs and lead to all sorts of conditions like cancer and lower respiratory illnesses, strokes, often causing death. So scientists have been showing that PM 2.5 exposure leads to increased rates of mortality and morbidity. And it seems like almost every decade there's new research that's coming out that's just showing how this problem is actually much worse than we thought. In fact, last year a new study came out that said that there were over 10 million premature deaths across the world because of fossil fuel component of PM 2.5. Now, okay, but what we found is that in many places in the world, there's very low awareness of air pollution levels and its health consequences. When you think about some of the most polluted countries in Asia, it's only until really recently that people are starting to think about this issue and demanding that their policymakers do something about it. What we're also seeing in recent years is that there's a strong link between PM 2.5 and the effects of climate change. PM 2.5 is primarily caused by fossil fuel combustion. It's the same thing that's causing temperatures to rise, drier conditions, extended wildfire seasons. And in the past few years, we've seen these kinds of effects all across the world, from Europe to California and so on. So the focus on air pollution does connect to this bigger problem of minimizing the impacts of climate change. And that's really a theme that many are beginning to talk about now. So the AQLI was created to answer two questions. Oftentimes when we talk about air pollution, people want to know, well, how bad is it in the community where I live, and what effect do those levels have on life expectancy in my community? And so what we've done is, we've taken, on the one hand, satellite-derived estimates of particulate matter concentrations from all across the world. Now, the benefits of satellite-derived PM2.5 data is that it's geographically extensive, so you could have a measurement for every part of the world, even places where there are no ground level monitors. And it's relatively consistent in that most of the places in the world you'll get PM2.5 measurements that are being calculated in the same way. So satellite-derived data is very useful. It's high resolution, and you could really see variation in pollution, within the country level and between cities and so on. Now sorry about this, the slides. Okay, so we take that satellite data and we combine it with applied economics research produced by colleagues at the University of Chicago and others, estimating the causal impact of sustained exposure to pollution on a person's life expectancy. Now, when you think about the relationship between pollution exposure and health outcomes, it's actually quite hard to measure this in the real world. That's because oftentimes all we really can see is pollution levels and rates of death. And there's a lot of things that might be correlated with both pollution levels in a certain setting, as well as health levels across the population. So one of the advantages of the AQLI is that it relies on research that takes advantage of a natural experiment, policy experiment that occurred in China during the planning period in the 1960s, over decades, where essentially China introduced a policy that subsidized the cost of coal for indoor household heating for some people and not others. And they used the Huai River, which kind of runs from the east to the west of China, right across the middle, as a dividing line. And everyone who lived to the north of that river were given coal to heat their homes because it's very cold. And everyone living to the south of the river did not receive anything. And the net effect of that was that over decades, pollution was much higher north of the river where this policy existed. And so the research team that studied this issue was able to zoom in to the river boundaries and find that as you move from the south side of the river to the north side, pollution jumped by quite a bit because of this policy. And at the same time, life expectancy fell. And the only explanation for this fall in life expectancy over the long run was this very arbitrary policy that created higher pollution conditions for one group versus another. So this is research that is able to estimate the causal effect of sustained exposure to pollution on a person's life expectancy, and is not necessarily a correlation. So the AQLI takes that research, those research estimates, combines it with satellite data on PM2.5 levels across the world, and puts it together in order to answer this question: how much longer would you live, or would the people in your community live, if they breathed clean air? So it's basically a website tool that allows you to zoom into whatever community you're interested in the world and examine this question. So here's a map of Vietnam. We're zooming into Hanoi. And here you could see that the PM2.5 level on average in 2020 was about 36 micrograms per cubic meter. And the AQLI answers this hypothetical question: what if that 36 micrograms per cubic meter were lowered to 5 micrograms per cubic meter, which is the current WHO guideline for safe air? What would that imply in terms of the average life expectancy impact for the average person, in this place? And in this case, what the AQI suggests is that if Hanoi could permanently reduce its pollution to meet the WHO standard, the average person would gain 3 years of life expectancy. Okay, so that is really what the AQI is. It was created to take research and satellite data to answer a very important question that could justify strong clean air policy action. So what is the impact of Thailand's air pollution on life expectancy? Well, the satellite data shows that Asia is home to some of the most polluted countries on Earth. Here's obviously in this map, you can see that India and Bangladesh are extremely polluted. But beyond South Asia, you could also see that parts of Southeast Asia and China are very polluted as well. And in comparison to, say, North America or Europe, this map looks a lot darker than those places, indicating that pollution is very high. Now, in 2020, the satellite data show that despite pandemic lockdowns and decreases in economic activities across the world, pollution actually rose by 10.8% in Thailand in 2020 compared to 2019. And in 2020, Thailand was the 4th most polluted country in Southeast Asia on average, trailing Myanmar, Laos, and Vietnam. Overall, across the globe, pollution in 2020 remained relatively flat. It was really the same level compared to 2019, but there were different countries that had different kinds of movement. So China continued its trend of declining pollution, but many other places like Thailand actually increased their pollution in a year when we thought that things would actually get cleaner. Now, this is a continuation of a longer term trend in Thailand. Since 2000, the average PM 2.5 level in Thailand has risen by 22.7%. And at times, it has been more than 5 times higher than the WHO prescribed clean air guideline of 5 micrograms per cubic meter, which was recently updated. But the point being, Thailand has been polluted since 2000 and probably earlier. And today, 100% of people in Thailand are living in areas where the pollution levels exceed this threshold of 5 micrograms per cubic meter. Okay. If you look at Thailand regionally, you'll kind of see what I think many of you would probably guess, which is that the northern regions of Thailand are the most polluted. So that's the dark red line at the top, followed by the northeastern region, then followed by the central region around Bangkok, and then the southern regions. The northern regions, pollution has been fluctuating from about 25 to 35 micrograms per cubic meter. So that's 5 to 7 times the WHO guideline. But even in the south, where I think many would associate as having clean air, pollution is still 2 to 3 times higher than the WHO guideline. So key sources of PM 2.5 include, many of the usual suspects in major cities like Bangkok. Common sources of PM 2.5 include vehicles, power plants. In the north, it's largely attributed to agricultural burning. But what I think is important to emphasize here is that Thailand currently relies almost exclusively on fossil fuel derived energy sources, despite its potential for renewables. In 2020, oil, gas, and coal accounted for roughly 95% of total energy consumption. So the AQI shows that the benefits of clean air in Thailand are are substantial. So here's another view of the map of Southeast Asia, but we're looking at the potential change in life expectancy from clean air view. So the darker orange or redder regions are places where residents stand to gain the most from clean air meeting the WHO guideline. If we zoom into Thailand here, we see here that on average, the population weighted PM 2.5 level in 2020 was about 23.8 micrograms per cubic meter. And what that implies, based on the research that we're using, is that if Thailand reduced that 23.8 down to 5 micrograms per cubic meter, the average person would see an increase of 1.8 years of life expectancy. If we zoom in a bit into the kind of northern and central parts of Thailand, you could see that the shading is much darker in the north. That's really where the gains are the greatest from clean air. But in Bangkok, pollution on average was 20.8, according to this new and revised satellite data in 2020. And residents stand to gain 1.6 years. The burden of pollution or the overall benefits of clean air are the greatest in Bangkok because of its large population and relatively high pollution. If you move to the north to Kamphaeng Phet, you could see that the pollution levels are much higher, averaging more than 7 times the WHO guideline. And here the gains from clean air are over 3 years. So when you compare the average life expectancy gain from clean air in Thailand, which is about it's just under 2 years per person, it's actually higher than the implied life expectancy benefit of eliminating other very common and well-known causes of death like smoking, alcohol use, and road injuries. So in terms of life expectancy, PM 2.5 is the greatest risk to human health in Thailand, as it is across the world. Okay, so the final thing I wanted to cover was really to think about this as the benefits of clean air policies. So I think history has shown that air pollution can be solved with clean air policies. If you think about places like the United States, they were very, very polluted in the past. In fact, 1970, late 1960s, there was basically an environmental crisis in the US. And that led a lot of people to demand cleaner environment, cleaner air. And that led US legislators to pass the Clean Air Act of 1970, which led to new emission standards, other kinds of pollution control in the industries, cleaner vehicles, et cetera. And as a result of that legislation, the US Clean Air Act, the US is only about a third as polluted as it was in 1970 today. And that's had the effect of increasing life expectancies. And oftentimes when policymakers are debating Clean Air Acts, they need to weigh the costs, the perceived costs to the economy of bringing in greater regulation and greater standards. And a lot of industries, make the argument that that is too costly and it's going to lead to slowing economic growth. But what the research suggests is that the life expectancy benefits, the benefits to people's health, are actually quite great themselves, and oftentimes could outweigh the cost of the pollution regulations. A more recent example of how air pollution can be solved with clean air policies comes from China. In China, pollution reached all-time record highs in around 2013. In response to growing public concern about air pollution in China, especially in the Beijing region, China declared a war against pollution and it committed hundreds of billions of dollars to reducing pollution. It shut down some of the coal-fired power plants in key regions. It required other coal plants to reduce their emissions. There was a host of different policies that they brought in. And since 2013, China has cut its smog by 40%. And what the AQLI suggests is that the benefit to Chinese society from those pollution reductions is an average gain of 2 years, for its citizens. So that's what this shows here. We're looking at a comparison of China's pollution in 2013 versus 2020. 2013, China's pollution was roughly 52 micrograms per cubic meter. It's now 31. That's a decline of 40%. And the gain in life expectancy from clean air was 4.6 years based on 2013 levels. It's now 2.6 years. So the net effect was 2 years. And what I want to show you is that if you take that same decrease, 40% is very big, right? It's very big. But if you take that same decrease for a minute and think about what that means in the context of Thailand, it would mean taking pollution from about 23.8 micrograms per cubic meter in 2020, taking that down 40%. And the social benefit of such a decline, assuming it's permanent, is roughly a year saved per person in Thailand of life expectancy. It's much higher in places like Chiang Mai and Chiang Rai, where the gain is more like 1.3 years from that type of decline. So what this emphasizes is that even though the costs of reducing pollution may be great to industries and to companies, factories, the resultant benefit to the people is also very great and potentially worth much more than those kinds of profit impacts for industries. And I want to show you this chart here. So this shows you just how much progress China has made through clean air policies and government will. You see that since 2000, China's pollution was rising very rapidly as the country was developing very quickly. Peaked in about 2013, they declared their war on pollution, and pollution has dropped drastically. The Chiang Mai region is sort of in a lightish brown. You could see that currently it is comparable to other major pollution hotspots that we've all heard about, like Jakarta and Hanoi. It's still lower than China's average pollution now, but wanted to show this to emphasize what China was able to do, because that, I think, might inspire what Thailand is able to do from these levels. So if we think about a slightly more achievable, but still very ambitious goal of 30%, what would that imply in terms of average life expectancy gains in some of Thailand's most populous provinces? And what it shows is that, well, somewhere like Chiang Mai, it's nearly a year gain from just even a 30% decline in average pollution. Okay, so to summarize, all of Thailand's 68 million people are currently living in polluted areas, and it's been that way since 2000. In the most recent year, average pollution was nearly 5 times higher than the WHO guideline. And the benefit of clean air in Thailand is an average life expectancy gain of nearly 2 years, or 1.8 years. And it is even higher in the northern parts of Thailand. And what I think this points to is the large benefit of clean air policy for Thailand's people. And that concludes the presentation. Thank you so much for listening, and to Rena and the panelists for doing this with us. Thank you.
Thank you so much, Ken. I think you are speaking to the choir here, actually singing to the choir here, because I know the number of participants in our webinar today are actually calling in from the northern part of Thailand. So what you're showing, I think they're really experiencing themselves. Let me just maybe, because it's so important, let me just maybe do a very quick summary of the key takeaway message in Thai, so the Thai audience won't miss it. สิ่งที่คุณเคนได้ดรเคนได้พูดนะคะก็คือว่าโดยเฉลี่ยแล้วPM 2.5 ของประเทศไทยในปีที่ผ่านมาเนี่ยอยู่ในระดับที่สูงกว่าที่ระดับของที่องค์การอนามัยโลกได้แนะนำนะคะเปิดถึง5เท่านะคะแล้วถ้าดูว่าการเสียชีวิตก่อนเวลาอันควรของคนไทยนะคะคนไทยเนี่ยโดยเฉลี่ยทั้งประเทศเนี่ยนะคะเราเสียชีวิตก่อนเวลาอันควรเพราะปัญหาของมลพิษทางอากาศเนี่ยถ้าเราใช้มาตรฐานเดียวกับที่องค์กรอนามัยโลกแนะนำนะคะคนไทยจะไม่เสียชีวิตเร็วขึ้นถึง2 ปีนะคะแต่ว่าถ้าคุณอยู่ภาคเหนือนะคะข่าวร้ายมากก็คือว่าการเสียชีวิตก่อนเวลาอันควรของคุณเนี่ยคือถึง2 ถึง 3 ปีเลยนะคะซึ่งเป็นตัวเลขที่น่าตกใจมากเพราะว่าทุกคนคงจะจำได้ว่าเรารู้ว่าประเทศจีนเมื่อก่อนนู้นเคยมีปัญหาเรื่องนี้ขนาดไหนแล้วหลังจากที่รัฐบาลเขาเอาจริงเอาจังซึ่งรัฐบาลเอาจริงเอาจังเพราะประชาชนเอาจริงเอาจังเรื่องนี้ก่อนนะคะเขาได้เมื่อก่อนนู้นคนจีนเคยเสียชีวิตก่อนเวลาอันควรถึง5 ปีเกือบ5 ปีนะคะเขาลดลงเกือบครึ่งหนึ่งเลยนะคะจากนโยบายของรัฐบาลนะคะเพราะอันนี้เป็นข้อความที่เราทุกคนนะคะไม่สำคัญว่าเราเป็นใครนะคะเราจะเป็นภาครัฐเราจะเป็นภาคเอกชนเนาะหรือเราจะเป็นคนธรรมดาอย่างหนึ่งที่เรามีเหมือนกันคือจมูกนะคะพวกเราทุกคนหายใจเหมือนกันเรื่องนี้เป็นเรื่องที่กระทบเรามากๆนะคะ Thank you so much again, Dr. Ken. That was really fantastic. And I think I would now like to move to the second speaker, who is Dr. Wirun Limsawat. And maybe I could ask Dr. Wirun to maybe, if he hasn't already, to turn on his microphone. He has, sorry, his picture. So Dr. Wirun Limsawat is, I would say, a double doctor. So he's got, so he's a medical doctor, he's a medical anthropologist and a medical doctor. He currently holds his full-time job. He is the director of Society and Health Institute at the Thai Ministry of Public Health. The role of this institute is to bring about medical anthropology into practical applications and policy discussions here in Thailand. Dr. Wirun also holds another hat, and that is that he is the co-founder of the Thailand Clean Air Network. He was instrumental in leading the charge to obtain buy-in from the Ministry of Public Health to take on and commit to developing the Air Quality Health Index for Thailand. And if we should ever achieve that, that would be phenomenal, because we would probably be, if I'm not wrong, the third country in the world to have such an index. Dr. Wirun has also led the initiative to develop the Citizen Air Monitoring Network, or CAIR, which is the abbreviation for this. And if this was successfully launched, it will be the first citizen movement nationwide air monitoring platform for the country. Dr. Wirun holds a master's and PhD in medical anthropology from Harvard University, and he has a medical degree from the Faculty of Medicine from Sirirat Hospital, Mahidol University. And the question I really have for Dr. Wirun is that he's someone from the medical front line, and I would like to ask for Dr. Wirun to speak about recent medical research, or even more anecdotally, what medical professionals have been observing in recent years due to the deteriorating air quality here in Thailand. So the floor is yours, Dr. Wirun.
Good morning, everybody. I feel good that I can be a part of this this event. I'm grateful that we have the Air Quality Life Index, because the most difficult thing to do when we work on the issue of air quality, clean air movement, especially in Thailand, is that we have less amount of the evidence to support the local specific problem of the air quality issue in Thailand, for example, because when we talk about the impact, environmental impact of any pollution or any specific risk factor, we need evidence But because of the air quality issue, it's very complicated. Therefore, I think what Dr. Ken just present to us is a very good tool, a very good equipment for us to increase awareness. Because when we think about air quality and health, we have evidence from all over the world, especially the World Health Organization, including the collective evidence to show us that the air quality problem, especially the PM 2.5, is the main factor that cause problem to people's health. But in Thailand, for example, I found that we have less amount of the evidence. We have only what Kun Vinalin just said, that the anecdotal evidence, that is the story told from medical doctors and health professionals. For example, two or 3 years ago, when we have a very heavy discussion about the health impact of the air quality in Thailand, there are some cases that present to us. A pediatrician told that she found a children that have the early stage of the cancer, and she by herself she found the story of that children that her mother exposed to air pollution. But that is just one case. There are many cases that need more aggressive study. I use the term aggressive because when we think about aggressive study, that is, we are trying to focus on finding the evidence to relate the health problem, cancer or any other thing, with the problem of air pollution. The other point that I want to raise here is that some of the non-communicable disease, such as diabetes, that is not commonly understood as related to the air pollution. There is a study in Taiwan that link the air pollution and the diabetes of the population. We have some evidence about this kind of problem in Thailand as well. So what we are trying to do is that we are trying to organize some collective effort to collect the evidence of the health impact of the air pollution in Thailand. But for now, I think what the AQLI help us is to increase awareness of this kind of problem, and the finding from the AQLI is that in the northern of Thailand, there are higher level of air pollution that will decrease the life expectancy of people in the north more than people in other part of Thailand. But this is the first step. I think the next step is that we have to understand that the PM 2.5 is in itself is dangerous, but the more dangerous is the substance is carried, because in the PM 2.5 there are many toxic substance, and it is different between place to place. For example, in the northern of Thailand, the high level of air pollution mostly come from the open burning. But for the central Thailand, the main problem can come from the industry. And this is why I think we need more aggressive study to understand what the really what is the real problem of the air pollution that cause the health problem in Thailand. We need a local specific study to find evidence, beginning with some kind of like anecdote or case study that we are trying to find, and then by that anecdotal problem or case, we can focus more on the source of the air pollution in each region. Therefore, I think what we have to do is that we can embrace the finding or the tool that AQLI help us to understand that the life expectancy of people in our country, in Thailand, for example, can be better. This is a very strong evidence. It's come from the economic study. So it can talk to the policymaker easily because policymaker like numbers. So we have the number of life expectancy and the benefit, cost benefit, cost effectiveness of reducing the air pollution that make us through the first step to put this issue on the table. And then we need more support to do research and to do the collection of evidence, and also to increase awareness of the health professional themselves. And I'm one of them to see more deeper into the health problem that we see, the increase of the cancer patient and the increase of the respiratory patient, and also increase number of the patient life diabetes patient. That is the main problem of the people in the new era that we think because of their personal behavior, we blame people for their personal behavior to cause diabetes. Is it the same that we blame people from doing the open burning to reduce the air pollution? Therefore, I think health and environment protection is inseparable, and we need more awareness, and we need more aggressive study, aggressive collective effort to make the evidence more explicit for the policy maker and also for the public to understand the problem of air pollution in Thailand. Okay, this is what I want to add now. Thank you.
Thank you so much, Dr. Revan. That was very insightful. I guess we're running a bit behind schedule, so let me very quickly then introduce our next speaker, which is Dr. Sumi Mehta. So Dr. Sumi is the senior epidemiologist from the Global Environmental Health Division of Vital Strategies, and Vital Strategy is a global public health organization. Dr. Sumi is a global health professional with 20 years of experience working in the intersection of air pollution, health, and development. She has extensive field experience in South and Southeast Asia, and has also worked in Africa, East Asia, and Latin America. So prior to joining Vital Strategy, she had served as the Senior Director for Research and Evaluation at the United Nations Foundation. She was also the lead scientist for the international program at the Health Effects Institute and was a policy analyst at the WHO. Dr. Sumi earned her PhD in anthropology. She has a MPH in epidemiology and biostatistics and a PhD in environmental health science from the University of California, Berkeley. So I think that, so she has a super impressive background, not just regionally and across the world. One of the questions I would like to address to Dr. Sumi is that I wanted for her to please share her perspective regionally, and that is that it is said that sometimes, as Dr. Wirun had pointed out, that things can get quite worse, right? Things can get worse before they get better. It's a common saying. And in this case, with the fight for air pollution, I wanted to hear about if Dr. Sumi could describe the health impacts of air pollution, in the Asian region, and to provide us a picture of how we can continue to protect public health while still experiencing rapid economic development, which was the dichotomy that Dr. Wirun was describing that's happening here in Thailand and globally. And also what can be done to promote more effective clean air policies for better health. So the floor is yours, Dr. Sumi.
Great. Thank you very much for the opportunity to give my thoughts here, and really thank you, Dr. Lee, for sharing some really very interesting and thought-provoking results. So I just wanted to start by emphasizing the fact that no one is really immune to air pollution. What we've seen, from the health evidence is that exposure starts even when mothers are pregnant in the womb, and then continues throughout the life course. And this is really something important to emphasize, because I think, as we've seen, and many of you may have noticed that when the air pollution is bad, suddenly people are concerned about it. But in fact, while people focus on these episodes, it is really the chronic or the long-term exposures to air pollution which is really driving the health effects. And so you might wonder, well, we've heard here from about the life expectancy, and you might wonder, well, how bad is this situation really likely to be over the course of a person's life? And one thing I just wanted to note, I'm really happy to see, in fact, that the results that Dr. Lee showed are very, very consistent with other similar estimates, including some that were released by the Health Effects Institute earlier this week. And I think this is very important, because these are, really different types of analyses that have been done. And the fact that they show similar results really also show just how robust the findings are, and really, lend more credibility to the evidence. And so, really simply put, if we think about this, what does this life expectancy mean? How do we think about it? Well, if a child is born in Thailand, on average, we would expect that a child born now would actually die around 12 months sooner than would be expected if they had actually exposures to air pollution and fine particulate in particular that is really closer to the WHO air quality guidelines. So this is really a substantial effect, and this shows just how much illness and time lost from really having healthy life, as well as premature death or mortality, can really make an impact on somebody's health. And I think this is something that we've seen around the world in all of the different epidemiology or the health studies that have taken place. I just also would like to note, again, in terms of consistency, that the health research that's come out of Thailand, and a lot of this has come out of Thammasat University, for example, is also very consistent and really shows the impacts of air pollution on respiratory as well as cardiovascular disease. So, as we think about this, I mean, one concern, and I know that this is something which has been mentioned earlier, is that the air quality in Thailand continues to kind of consistently be well above the WHO air quality guidelines over the past couple of years. And the challenging thing is that, in fact, the air quality levels are really very close to what is currently the national PM 2.5 standards of 25. But this national standard is roughly 5 times greater than the health-based guideline levels, which have been set by WHO. So if you look at the current standards, you would think, well, the air quality is actually rather good. It's rather fair and seems to be relatively close to the standards, when in reality, it's a major public health concern. And in fact, we've seen in Thailand a steady increase in the air pollution related illness and death, with over 32,000 deaths every year occurring as a result of air pollution. And as I mentioned, most of these deaths are from respiratory and cardiovascular disease. It's going to be really difficult to emphasize the urgency of this situation until Thailand is able to adopt more health-based standards for air pollution. But at the same time, you asked about kind of, how we can think about addressing this problem. I think standards are very, very important, but alone they're not sufficient to improve air quality. We really need to think about the implementation as well as the successful enforcement of clean air policies that can really ensure improvements in air quality and associated health benefits, as well as climate benefits over time. So I think the good news, though, is that we know that there are proven, very effective solutions to address all of the leading sources of pollution in Thailand, whether we're talking about mobile sources, in mainly road transportation, industrial combustion and processes, or waste management. In addition, I think it's really important to note that these improvements in air quality are very compatible with continued economic growth and development. So just to leave you with a very simple example here, we know that even that if you can make sure to implement better emissions and fuel standards, for example, you can actually continue to get reductions in air pollution from mobile sources, even with increasing numbers of vehicles on the road. So I think I'll just pause in the interest of time here, but would love to continue the conversation. And again, really, thank you so much to everyone so far for their really thoughtful comments.
Great. Thank you so much, Dr. Sumi. That was really, really insightful. And because your message is really important, let me just quickly do a quick summary in Thai. And that is that Dr. Sumi ค่ะได้กล่าวว่าการเสียชีวิตของเวลาอันควรของคนไทยที่เกิดขึ้นจากปัญหามลพิษทางอากาศนะคะเป็นเรื่องที่น่าเสียดายมากเพราะถ้าสมมติเด็กเกิดณตอนนี้นะคะในประเทศไทยคือคิดได้เลยว่าน้องจะมีโอกาสที่จะเสียชีวิตเร็วขึ้นถึง1 ปีเลยนะคะซึ่งแย่มากสิ่งที่ดร. Sumi พูดก็คือว่ามันมีจริงๆมันทุกอย่างเนี่ยค่ะมันมีทางออกนะคะในการแก้ปัญหามันมีทางออกในเรื่องของมลพิษทางที่จะมาจากรถยนต์มันมีทางออกในการแก้ปัญหามลพิษที่มาจากอุตสาหกรรมมันมีทางออกในทุกๆด้านนะคะเพราะฉะนั้นเนี่ยมันเป็นเรื่องที่จริงๆทำได้นะคะการปรับมาตรฐานของน้ำมันนะคะไม่ได้หมายความว่าจำนวนรถที่จะขายได้มันจะลดลงถ้าเราเปลี่ยนประสิทธิภาพของน้ำมันเชื้อเพลิงที่ใช้นะคะมันจะทั้งเพิ่มในแง่ของคุณภาพอากาศของในประเทศไทยและไม่ได้หมายความว่าการทำธุรกิจสายรถยนต์จะพังพินาศมันมีทางออกที่เป็นวินวินนะคะอันนี้เป็นเมสเสจที่สำคัญมากๆนะคะ so without further ado let me also now quickly introduce our fourth speaker. I think it's we've seen the impact of air pollution in terms of health impact. We've seen this situation here in Thailand. Dr. Sumi has also given us a perspective from a global viewpoint. And I think now it's sort of trying to showcase sort of how we can actually work better together. And I want to introduce our fourth speaker, and we're very delighted to have Fajihah Fadila, who is an environmental lawyer from the Indonesian Center for Environmental Law. He is also one of the key members of the Ibu Kota Coalition, which is a coalition in Indonesia fighting for clean air. And a quick rundown of Fajih's degree. He has his credential. He has a law degree from the Faculty of Law from the University of Indonesia, and which is focused on the issue of the principle of prudence in environmental law. He has been working in several advocacy cases related to pollution control and on environmental damage. And amongst them, one of the ones that we've all heard of, which was in the news last year, was the famous citizen lawsuit in Indonesia against the president and 6 officials for not managing Jakarta's air pollution. He's also involved in a judicial review against the president's regulation on accelerating the construction of waste power plants with thermal technology in 7 cities in the country. He is experienced in advocating for regulation in the field of pollution control, environmental damage, in the area of air pollution control, and in the field of waste reduction. He's currently focused on environmental law, specifically in pollution control, environmental damage, in the aspects of prevention, environmental monitoring, and law enforcement. So with that huge amount of experience, what I would love to hear, I think everyone would like to hear, is the case of in Indonesia with the Ibu Kota Coalition. I understand that there is some 135 lawyers I've heard who's been working pro bono on the landmark court case in Indonesia. And I understand that a lot is still happening as we speak. So I really wanted to hear about some of the key challenges and success factors that have led to the win, the court case win in Indonesia. So without further ado, the floor is yours, Fahisha.
Thank you, Wina. So starting from with the challenges in the process of advocating clean air in Jakarta, I want to share 2 challenges in the process that beginning at least from 2017 in Jakarta. And the first challenge is building the foundation, the beginning of the movement. Because at the beginning in 2017, I really remember that we start with only a few active organizations that have focus on advocating clean air in a lot of cities actually, but has a special interest in Jakarta because the problem is there, but people doesn't really aware on that. And at the beginning, we haven't got the support of public at large because we still beginning with raising the awareness. For example, Bondan later can explain regarding putting air quality monitoring in several points in Jakarta. And of course, at the legal aspect, the challenges is also convincing the other partners that we have a strong legal arguments to push key actors to take action to clean Jakarta's air. And in hindsight, when we get our verdict in 2021, I really recall the difficulties in the beginning of the case in 2017. And the second challenge on this advocacy, I think it is on establishing scientific and legal facts of Jakarta air pollution problem. We remember in 2018 the public debates surrounding Jakarta air pollution problem when Jakarta will be or will organize the Asian Games in 2018. I remember that the debate is whether the Jakarta is really having an air pollution because the government of Jakarta and also the national government denies that facts, and also we are debating on the basis of air quality index compared to the national ambient air quality standards. That's really technical and can get people really confused. And also another thing relating the emission sources, the perception of public in Jakarta is that mostly air pollution problem in Jakarta is coming from mobile sources, especially motor vehicles. So that belief that is really challenging to be explored, because we try to also expose the problem of other sources. There is also stationary sources in Jakarta, and more difficult showing that Jakarta problem is really a regional issue, because stationary sources in the neighboring provinces in West Java and Banten, the western part and eastern part of Jakarta, is really contributing, I can say, significant portion of air pollution in Jakarta during worst pollution episodes. That also challenging to be taking off in terms of scientific and also in legal facts, because Indonesia doesn't really have the explicit legal terms to tackle transboundary pollution issue, especially on air pollution. And moving to the success factors, it is also relating with the challenges. I think the success aspect is first, it came from our effort to build an air pollution narratives that really relates with the value of public. For example, we also start with, I think it's similar with other places, the damages or the cost that public really burden because of air pollution. We start with that. We start by relatively simple, because we are digging the existing scientific research that already done in Jakarta. It's quite plentiful, but public do not know that research. So we use government data, because government tend to challenge our data, or for example, data from their air quality monitoring from Greenpeace, for example, or the correlation with the health damage. Government tend to deny that, and we use government data relating to air quality in Jakarta, and also the relation with the health effects, and so that it is government data that say that we are already burdening a high amount of costs. For example, going back in 2010 and 2015, the government has that model on that, and also it is really relate with the public, because we show the vulnerable groups on that aspect. We use the voice of concerned mother, because their children have to go to school with bad air pollution. They tend to have their children missing their school days because of these conditions. It really relates with, fortunately, with many class of citizens in Jakarta. And the second one, on that, I'm still in the first. I think it really, continuing with Dr. Kentley presentation, I think Thailand or Bangkok especially is really similar with Jakarta, because we have the underlying problems that already go on for decades, because the data shows that Bangkok has an air pollution problem starting from 2000 until now, and it is also same story with Jakarta. And our success came from that, because we dig existing research going back to 1997. There is a study from the World Bank that already predicting that Jakarta will have a big problem on air pollution, and go on to the decades of 2000s and 2010s. And it shows the conclusion that the Jakarta government and also national government have neglected this problem for decades, and it is, of course, mind-blowing for the public and also the judges. And then the second one, relating with the challenges, expanding the movement. I think this is also a great success because we start with a few organizations, but we expand with the public. We open the citizen lawsuit option to the public at large and gathered additional plaintiffs and also people who want to testify and to share their story. That's really powerful and relates with the decision makers, of course, the government, but more specifically to the judges that handle the case. That's two challenges and success story that I can share with Jakarta Air Pollution Advocacy. Wina, hope can have a more conversation later. Thank you.
Great. Thank you so much, Fajri. That was very, very insightful. We're sort of running a little bit behind schedule. So let me just then quickly introduce our fifth speaker. Before that, I know there have been questions coming in from the Q&A. We don't want to hold people off. If you have any questions, please put them in. Panelists have been fantastic at answering them. So don't hold back doing that. Okay, now our last speaker is Bondan Adrianu, sorry if I completely mispronounced your name. He is the climate and energy campaigner for Southeast Asia. Bondan has been working with Greenpeace Southeast Asia now. He has over 15 years of experience driving public communication campaign. And since 2017, he's been focused on the air pollution work, specifically on the reduction of fossil fuel, which is the key focus, with a key focus on coal specifically, which is a significant source of air pollution in Indonesia. His work has also been in the area of health impact awareness of air pollution through public education training. Bondan has obtained his undergraduate degree in geography from the University of Indonesia. And I guess the issue I have, which is a good follow-on from what Fajri had shared, was I wanted to know about the importance of, everything we've said so far is all very important, but unless and until this public will behind it, it's going to be very difficult to move anything. People talk about political will, but before political will, there needs to be public will on this. And could you share with us about the successful factors that have supported this huge effort that you've done in Indonesia and some of the challenges in terms of building a public campaign for the Indonesian air pollution case that you've recently won? So without further ado, the floor is yours, Bondan.
Thank you, Wina. Thank you, and all participants to keep on patient listening all of us about air pollution. So I can start the sharing the campaign about air pollution in 2017, like Fajri said. When we start the campaign, we decided which audience we are going to reach and what is the concern most. Like Jakarta people, we like doing like small research. Jakarta people in urban cities, in generally, they really concerned about their health and the health of their children actually. So we decided to campaign about air pollution issue. First, we are searching what is the data behind air pollution. At that time, 2017, government data showing zero data of PM2.5. Even at that time, 2017, government have nothing at all about PM2.5 data. They only have PM10. And even if we look more on the regulation, at that time, the government still using the regulations since 1999. It's a like overdue regulation, so it need to be revised. So that's kind of data we search first, and we come up with an idea. How not we just provide our PM2.5 data by ourselves? So Greenpeace are at the time developed mobile apps. It's called Udara Kita. It's called, in English is Our Air. So the apps is basically providing PM2.5 data real time using low cost sensor. What happened at that time? So the government always said Greenpeace are using not valid data. So the debate is about the device that we are using is not valid, but it is confirmed that government have no data, have no official data at all to show to the public. And then as Fajri said, we use the data that how dangerous it is to find pipes to your health. So government cannot answer more when the public said, which your data. So finally in 2018, if I'm not mistaken, end of 2018, government installing their own PM2.5 devices all over Jakarta. But it's still lag because we are also using the narration that in Jakarta itself, we need to provide like 20 to 30 PM2.5 air monitoring station. While now, 2021, we have only like 7 to 10 devices. Like it's far from enough to provide air pollution data in Jakarta. And then next, how to delivering the facts to the public. We made so many infographics to the social media, and then we also collaborate with CNN Indonesia, who provide very strong and powerful message to the public that showing we put the PM2.5 data device on the children during the school, from the house to the school and then coming back to the school again. So that's showing the PM2.5 data increase when the children is walking by to the school. So it's powerful message that PM2.5 is increasing real time. So the device that we are used at that time is calibrated one, and it's a scientific one. So the government cannot deny more about the reading of PM2.5 data. And the next, when we go viral, like questioning and answering in the media between Greenpeace and the government, at the time publics like start questioning, what's wrong with the government? This is the real data, and this is the real impact that also we also deliver similar facts with the AQI showing that how PM2.5 is like creating health like heart disease, pulmonary disease, and so on, even stroke. So the dangerous is there, and we are targeting the audience. We are decided which audience we are going to use, or we are going to target it. At that time, we are targeting like young Gen Z people who actively work in Jakarta, and luckily that at that time with the coalition we developed this coalition Ibu Kota since 2018. And if you want to know, at first there are many NGOs who put in the coalitions at that time, but during the time so on, we put down the logos of all NGOs, so we bring onto the public that this movement is belong to the public, not belongs to the NGO. So this like bringing a powerful message. There is a coalition without any NGO, without any correlation with the politics, that we are bringing this message. We are wanting clean air, something like that. And this is quite successful. At that time, we developed a platform called akudanpolusi.org. In English, it's Me and the Pollution. We got like 25,000 signers at that time. And it is also, we are lucky that 2018 and 2019, when the time we submit the citizen lawsuit, at that time, Jakarta has a very small amount of rainy days. So it's like dry season during all the year. And what happened during the dry season, the air pollution is rising in Jakarta. So the moment is very take advantage for us, because at least the public said, oh yes, this is air pollution. We have no blue skies in Jakarta, and people watch it directly. And I remember one of the celebrity Instagram, they posted our petition platform, and it's running well until 20,000 signers. So we didn't paid advertisement for this social media at all. We just bringing to the public that this is the issue, this is the problem. So we need your support for this movement. And finally, the key success and the challenges of this campaigning the issue is we need to have a strong coalition NGO, and we need to have public support by not bringing the name of NGO in front of the campaign, because somehow maybe this is the character of in Indonesia, in Jakarta, yeah. Once you are very related to NGO or related to any political parties, so the public are step back to want to support you. So that's why we are bringing down other NGO names, or even we don't have any coalition with the political parties. So that's why this is supporting us very much in the citizen lawsuit. And the persistence, how we delivering the facts and the data, even in 2019 and 2020, the government have their own official data, and the data showing the air quality is unhealthy. So now, not only Greenpeace are providing like independent air monitoring application. There are many more now coming to Jakarta. We have nafas.co.id who have installed more than 100 air pollution monitoring in Jakarta, all over Jakarta and surrounding. And finally now, all people are like almost aware the air pollution in Jakarta. Why I told you almost aware, because there are many audience we need to reach in Jakarta, like Gen Z audience and millennial, and even all the bubble beyond that we need to reach. So now it's getting bigger and bigger, and people are more understand what PM 2.5, and now even the citizen lawsuit we won in 2021, and now we have also another petition support us to ask government to implement the citizen lawsuit. So that's the update from me. Thank you, Ina.
Thank you so much, Monan. That's really, really insightful. And I think a lot of the key points you've raised is very applicable here to Thailand as well, and extremely useful. And we're trying to formalize in a right way. And I agree, this is way beyond politics. It's way beyond any organization, and it has to be that way. And so yeah, so that's I guess for us, I think the awareness level in Thailand is there. I think people are aware, people are taking steps to protect themselves at an individual level, but taking the next step to actually push for policy change, that is our biggest challenge. I think people become very too fatalistic. You know, they feel they're too small, they can't do much, it's too big a problem. And it's a bit of what I would call a self-fulfilling prophecy, because if you think you can't, you don't do it. Everybody thinks the same 70 million people do not do this, therefore nothing changes, right? But I'm really, really inspired by what you guys have done in Indonesia, and we really do take heed from what you do. We are really running out of time. We've got about 11 minutes left, and I know a lot of people have been asking questions, and thank you so much to the panelists who've been helping answer those questions in there, and that's been fantastic. We want to make this as engaging as possible. I did not intentionally cut anyone off because everybody had such amazing points to raise. So I would like, I know we don't have much time, but I would like to ask if the panelists, if the audience had any other like pressing questions they would like to raise, they could do it, through the chat, or they could do it, if they want to raise a hand, if that, or you could do it even, if you'd feel inhibited to ask questions here, you could also maybe send us a question later, and we could, submit it to the panelists, and they could answer it for you if that's the case. So นะคะ I'll quickly speak in Thai ถ้าใครมีคำถามอะไรอีกนะคะอย่าอายอย่าเกรงใจถามได้นะคะแล้วเมื่อกี้นี้ก็เห็นแล้วว่ามีคำถามตอบตามเกี่ยวกับเรื่องรถนะคะอันนี้ก็เดี๋ยวเอาคำตอบของดร. สุมิตแล้วก็ไปแปลเป็นภาษาไทยนะคะก็น่าจะเวิร์กนะคะแต่ถ้าใครมีคำถามอะไรอย่าอายตั้งคำถามก็ได้หรือว่าไม่อย่างนั้นก็ถ้าคิดออกและอยากจะตั้งคำถามหลังเสวนานี้ก็ส่งมาทางเราก็ได้นะคะเดี๋ยวเราจะส่งต่อให้กับแขกผู้รับเชิญนะคะOkay, sounds like everyone's gone completely dead silent on me, so I presume I see no hands raised. I guess what I wanted to do was maybe do a very, very quick summary of what everyone's said, which is that we've got the amazing insights from Dr. Ken and his team on the research in Thailand. And we see that, Thais on average are losing, almost 2 years in terms of our livelihood and our longevity because of air pollution, which is startling, and it's much worse up north where it's almost 2 to 3 years. And there, and what we've heard from Dr. Wiwun is that, like in Indonesia in the past, there are obviously some challenges on the data side. But having said that, I think if you speak to any medical doctor, and all of them can tell you right off the bat, they're seeing a lot more sick people coming in. And what's really sad is these sick people are coming in much younger, right, than they should be, and that should not be the case. And Dr. Sumi has shared with us, that it is possible to deal with these things. It is possible to still grow economically. There are solutions to these things. It is we have these solutions. It's just finding the way to implement these in a way that works for everybody, because ultimately we all need to breathe. And I think we're really being inspired by what's happening here in Indonesia. Indonesia have really galvanized, brought people together. They've targeted the people who feel the most, and it's a case in Thailand too. When we've noticed, like, the people who have the most pain point on air pollution, it's actually moms with young kids. They're the ones who are still tracking this issue, and everybody else is, not that concerned about it anymore. But it's more than just moms with little kids. This affects our aging parents. This affects anybody in our family who's ill. Right? It affects pregnant women. It affects anybody whose work needs to be outdoors, right? You've got no choice. You've got to be in the outdoors. So it does affect a lot of us. And so this is a matter that is rightfully said so by Bondan. It's way beyond politics. It's way beyond any organization. And it's about all of us. And that's the sort of the key takeaway message, I think, that we want to kind of impart you all with. And I think there is this thing they talk about, which is the knowing doing gap. Then this is a famous quote by Carl Sagan that says that anything that you're interested in, really, whatever it is, it's not going to happen, right? If you can't breathe the air, drink the water. Don't sit this one out. Do something, right? And we all take breathing for granted, right? It's something we all do. And this is an issue that won't affect you if you don't need to breathe, basically. And I think in the case of Thailand, it's a really critical period right now. The citizen-driven legislation has been submitted. It is there in Parliament right now. It's on very shaky grounds until and unless public actually stands up to express their demand that the policymakers take this seriously. The chances of it falling apart is very high. So what can you do? Call to action. Please follow us. We have a website called thailandcan.org. Very easy to remember. CAN stands for Clean Air Network. We actually did a bit of borrowing from President Obama. So remember his slogan, yes, we can. So if you remember that, Thailand can, right? So .org. So follow us on our website. All the links to social media are there. We do have a public campaign on change.org. We now have about maybe 45,000 people or thereabouts who support the submission of a Citizen-Driven Clean Air Act. There are 70 million people in Thailand, okay? 70 million people who need to breathe. So we do need a lot more numbers. This is not official, but showing huge numbers really, really sends a strong message to the policymakers, right? That people care about this. So please, get the word out, spread the word out, tell your friends and contacts, get people to sign up on this. I think it would make a big difference. So, and I've put in there 3 hashtags that we've been using. And the Taiwan is the one that's actually been out there in the media. But this is the ones that we've been using to try to tell the policymakers this is something that we all care about, and we do really want to push this through. I noticed there was one quick question in Q&A. I think someone's already answered it. So I think we're probably good to go. So anyway, so we are right on time right now. And I guess we've got about 6 minutes left. So I would like to open it up to the speakers if there's any sort of final messages that they would like to impart for the audience, or any key messages, or perhaps I didn't completely summarize some of the key messages well. If anyone wants to do that, please feel free to unmute yourself and jump in. We have about 5 minutes to run.
May I add something very important that
of course
previous and coalition at that time, we are searching who want to speak about health at that time. So finally we found like pulmonologist organization who want to speak about air pollution. It's quite strong, and even they have a press release during the long day at the time. I forgot. So all the request or the ask from the pulmonologist is almost the same like our coalition, like providing devices, air monitoring, stronger standard, and giving standard that will protect sensitive groups. So I'm saying that expert will be heard by the public, not the NGOs or the police. When the experts speak about the health impact, it's going to be affect much.
Thank you so much, Bonan. That was really, really useful. I also want to put another point in. I know reading legislation is not a fun thing for any non-lawyers out there, but specifically for the Draft Clean Air Act that's out there right now, it's on our website. There is an English translated version. What I really want people to do is, glance through it. We have a summary of it. We have it in all various forms. We've got it in a very simple video. We have it in a 12-page document, and we have the whole shebang, which is like 124 sections. But I think the key thing about this is that this legislation is a reform legislation. So it deals with the underlying structural issues. And it's not one that is full of penalties by any means. The only penalty aspect of it is related to transboundary haze, okay? Everything else in this legislation, as per aligned with environmental law, it is about providing incentive structure for economic actors to do what it takes to amend their current operations in a way that will bring about clean air, right? So I just wanted to say that this is something that whatever hat you're wearing, whether you're coming from the private company perspective, whether you're a policymaker, it is not that scary. It is really something that it will be a win-win for everybody. The structures are well laid out there. It is drafted by people with immense background in this area. So I would really encourage people to have an open mind and to read this, because it really has structures set in there for a win-win solution for everybody. And I think when it comes to clean air, this is something that affects all of us in every way. I do see we've got 3 minutes left, and I do see that there are 2 open questions. So let me quickly read them. So, okay, one is in Thai. Okay, but I'll quickly read the one. There's one that talks about, that's directed to Boden and Fajari. And that question is that, is there any government done about air pollution success? I'm not so sure what that means. Oh, it's gone. Okay, great. Yeah, I guess that one's answered. I think, and then there's one question in Thai, which is talking about, okay, I think I've answered that one. Okay, which is talking about how legislation can be the impetus to solve air pollution here in Thailand. And also what would happen if this draft legislation was rejected? Well, there are different ways to skin the cat, obviously, but I think the critical thing is whatever path we go down, first and foremost, until there is a rule of engagement that deals with the structural issue of what we're dealing here in Thailand, this problem will never go away, right? I mean, right now, there is no clear entity to address this problem. And I think that's a classic case across the world in problems of air pollution. It's the most difficult science, right? It's an invisible killer you can't see with your eye. Therefore, it does not make any sense to not have a separate legislation that deals with something so complex. And there are ways around it. I think the most important thing, don't worry about how we'll get there. I think more important, I think is to be involved and to take ownership of this issue, because this is about you. It is about the very breath that you're breathing right now. Yep, and we're exactly right on time. Oh, there is one final question. It's coming in as well. Oh, I think it's the same one. Okay, I think I've answered that one. Yeah, so I think without further ado, we're right on time. Yes, is there something?
Dr. Will might have some. Dr.
Oh, sure, please. Sorry, I forgot to see that. Please go ahead, Dr. Wirun.
Okay. I would like to add a final point. It's very related to what Kun Viren just said. I didn't mean that there are no action in Thailand. What I mean, we need more aggressive measure, because it is a structural issue. It is a structural violence, and it's also a cultural violence. We have the culture of compromise. Everything will be good on the status quo. Therefore, we need more aggressive measure in our levels, including academic collection of evidence and also the reform of the law itself. Thank you. This is why I think it is very important that we have the AQLI as one of the measure, the tool to raise awareness to support our Clean Air Act.
Dr. Virun, if you don't mind, would you like to provide the quote you normally talk to explain cultural violence in the context of being a soldier?
Oh, I see. Now, all over the world, we are in the age of militarization of the state. Every citizen is seen to be a soldier who will let to go to the forefront to die for the country. And now, our people in Thailand and many places in the world are soldiers that the government let us die for the prosperity of the economy. It is injustice, and this is why we have to ask for our right to breathe clean air. Thank you.
Thank you so much, Dr. Virun. I think his analogy kind of places the emphasis quite well. Because if you're a soldier, you're actually being paid to be put on risk. But none of us, I think, were ever signed up to do this. So in any event, we're about 2 minutes past the hour. Thank you so much to all the panelists. It's been a really great and engaging session. This webinar is being recorded, and we will post it up on YouTube so people can watch it afterwards. And thank you so much. And I'll end it right now. Thank you.